The doctor-patient relationship is the cornerstone of good medical care. Good communication improves accuracy and efficiency of clinical practice, as well as patient satisfaction. During the medical interview, we know that doctors interrupt early, seek specific information, and struggle to effectively respond to emotions. This leads to the doctor commonly missing issues that are important to the patient. Communication skills are not innate, but can be taught and learned. What do our clinicians think about communication and CPR decision-making?
It's not easy to just encapsulate how to communicate about end of life, but there are two simple things that can be said. One is that you have to know what it is that you're trying to say, and you also need to develop some skills in how to say it. So there's what you need to say and how you need to say it, and those are the two wings of the bird. If you don't have one or other of those, it won't run very well.
I think it's really important that when we just have a discussion, that as a clinician we have all the information when we meet with the patient, so that it's an informed discussion.
I think you have to be sure about who you're talking to. In other words, the patient and whoever else they want there, or family members that are key decision makers to all of this lot. And then the most important thing of all is to open with an open-ended conversation starter. Something like, you must have talked to a lot of people over the last few days. Can you tell me in your own words what you think is going on? What do you think is happening here? I think it's very important that you don't provide yes-no options all the time, and I think it's important that people feel like any discussion about end of life is embedded within a general conversation about the patient's well-being.
We need to find out how much the patient wants to know and be involved in the discussion.
It's extremely important to engage with information and communication skills that are appropriate to your audience.
We know from a lot of research that a patient will communicate emotional content far quicker than they will cognitive and intellectual content. And the important thing in that is that as clinicians, we're not really taught about how to deal with emotions. And really, I think that's the root of why these conversations are difficult or can be challenging.
There are a number of mnemonics out there that you can use, all of which are quite valuable, and I would strongly recommend adopting a mnemonic approach.
Trust, I think, is really important in CPR decision-making, as it is with many other aspects of communication. Patients need to be able to trust the technical knowledge that we provide and our recommendations. They need to be able to trust that we have their best interests at heart. And for CPR, they also need to be able to trust that if they have an order to withhold CPR, that we still will provide high quality care, and that doesn't mean they'll miss out.
The main indicator, however, of successful communication, and the main take-home message about successful communication, is that you spend more time listening than you spend talking. You know that you've achieved something when you actively listen to the other person and that they feel actively listened to. And there is a general feeling that if you spend 75% of your time listening and 25% of your time talking, you'll actually be regarded by that person as a successful communicator.
The better our communication skills, the better we will care for our patients. We can emphasise to the patient what will be done before discussing what won't be done. We can then align our treatments to meet the patient's goals of care. Learning communication skills is complex. It requires learning about tools, practicing using the tool, then applying to clinical practice and seeking feedback. The clinician then starts the cycle again, further refining communication expertise. What follows are 2 doctor-patient interviews in the same patient. 2 tools are introduced. Ask, Tell, Ask promotes the doctor to ask open questions to get the patient perspective and their agenda. Then from there, the doctor can build on giving them information that is particular to them and useful to them. Nurse is another tool which assists the clinician to respond effectively to emotions. When reviewing the scenarios, consider what is done well and what is done poorly. Supportive resources are available to optimise the learning experience.